Welcome to another episode in the series of Pros Pro Bono Meets the Client. And today we're very happy to have with us Elaine Posner, if that's the right pronunciation, Elaine,
It is indeed. Thank
from
you.
BVMI in New Jersey. So why don't you begin, Elaine, by telling us what does BVMI stand for and what is the work that you do in New Jersey, in Bergen, and what is the problem that your organization sets out to address or even solve?
Thanks, Andrew. BVMI stands for Bergen Volunteer Medical Initiative. We are a healthcare facility that provides free primary care to people who live in our county who don't have access to care. They don't have insurance, they don't have Medicaid, they don't have Medicare, and they just can't afford to go to the doctor. Um, Most people don't know Bergen County is one of the richest counties in New Jersey. However, there are 35,000 people who don't have insurance and can't afford to go to the doctor. So our healthcare center is trying to fix that and help that.
And it's staffed by volunteers, you say?
We have about 150 volunteers, doctors, nurses, nurse practitioners, people who interpret, thank you very much, people who translate documents, people who do outreach. But yes, we have volunteers who take care of that for us. Absolutely.
And for those outside the US, can you explain a little bit about how it is that people don't have access to insurance or Medicare or Medicaid? How does that come about?
So we have a lot of patients who are working part-time jobs. They might be being paid cash. They are just they fall through the cracks is how we look at it. There's a certain income level that you have to meet in order to get insurance, or your job has to give you insurance. And a lot of these people don't have jobs that give them insurance. People who don't have Medicaid might be people who are in this country for a short amount of time. If you're not in the country for, I believe it's 5 years, you don't qualify for Medicaid. So people who are new to this country, who are working, who are trying to better their lives, just don't have anything. So they end up in the emergency room. It's very sad.
And what happens when those people who don't, if they go to a hospital, are they turned away?
They are not turned away. There's something called charity care at a hospital. However, you don't want someone who has the flu to go to the hospital.
No.
You don't want someone who has a chronic disease to go to the hospital and manage their care at the hospital. You want them to have a primary care physician who is managing their care. We have about 1,200 patients, and a lot of them are pre-diabetic or they are diabetic. Those are things that can be handled by a primary care physician. You don't want someone to have an emergency and go to the hospital when they can be taken care of. So what we aim to do is keep people out of the emergency room, out of urgent care for things that can be treated. We have great doctors who look at the whole patient. So that's kind of what we do, and it's really important.
Excellent. So those doctors are working in their own free time alongside their regular jobs, I imagine.
Yes, we have some doctors that are working. We have some doctors that are retired. We have some doctors that are going towards retirement and trying to figure out, their life. But many doctors are still in practice, but they believe, like we believe, that healthcare is a right. You shouldn't have to beg for healthcare. You shouldn't have to, pay out of pocket if you can't afford it to go to the doctor. So that's why we have so many amazing volunteers.
And are there initiatives like yours throughout the states in every possible county?
Um, there are there's an organization called Volunteers in Medicine, which is um, uh, they're all over the country. There are about 95 volunteers in medicines throughout the country, excuse me, who provide care. Every organization is different. It's its own nonprofit, its own entity, but the goal is the same. Volunteers provide the care that is given to people. None of the organizations bill the patients. None of the organizations get health care reimbursement from the government. It's all free and it's provided by volunteers.
But how about the actual equipment? I mean, where does that come from? And the medicine and the the various drugs that you need?
Those are very good questions. A lot of our equipment is donated. If our equipment is not donated, we fundraise for it. We do a lot of fundraising. We have a very large budget for things like rent and equipment and whatever else you need to run a healthcare center. We have been very lucky that people know about us in our area. So if a doctor is retiring, they will call us up and they will say, "We have an exam table. Do you want it?" But otherwise, we go out and we purchase those things with the funds that we raise money for. It's the development team has a challenging job.
Okay, sure. And tell me a little bit about how language comes into this, because obviously most of your doctors, I imagine, are English speaking primarily, or do they
That
come
is
from a multinational background?
Well, that's a very good question. We have probably 70% of our patients are not English speakers first, and probably 10% of our practitioners speak another language. So, language is very important. And one of the things that our founder, Dr. Sam Cassell, who was a lovely man, believed in was that um, we have a culture of caring at our facility. And culture of caring means that everyone feels welcome and important the minute they step in our facility. And one of the ways we do that is we make sure that there are people who speak the language that the patient speaks in the patient room so that the patient understands what's going on. So, language is really important. We always have interpreters in our space. Um, People who speak Spanish is a very big language for us. We have Korean speakers, we have Turkish, we have Albanian, we have Polish, we have Hindi, we have a lot of languages that we speak, and your um, your volunteers have been amazing for us because they have helped us in our patient rooms make sure that the patient and the practitioners understand what's going on is really, really important to us. So
Okay,
thank you.
that's great to hear. So that's on the interpreting side. And then we've also done some translation for you as well of documents.
You have. We have a lot of patients who go to their home countries and see doctors, and then they come back and they bring us reports that we cannot read at all. So then we call and we say, "Help, Andrew, can you please have this document translated for us?" And you do that, and that helps us provide care for our patients because then we can see what has happened in their home countries. So thank
Okay.
you.
Well, that's great to hear. In fact, I think BVMI was one of the very first clients we began working with because we only began in September 2022. And I'm sure fairly soon after that, maybe in the autumn or the winter of 2022, that we first came into contact. So I'm very glad we did. It's been great working with you over the last year and a half. And here's to many more collaborations again in the future.
Oh, thank you, Andrew. I appreciate all of the help that your volunteers have done for us. We really could not have done the work we do without all of the help that you have given us. So I really, really appreciate it.
It's a great pleasure. Thanks, Elaine.
Thank you. Have a great day.
You too.